Oh. And your lift is not working even.
Can you manage? Would you like a cushion or something?
Yeah, if you can arrange something.
Certainly.
Thank you.
Let's try this here, see how that is for you.
Okay, cheers, thanks.
Do you want to pick your leg up at all? Or?
No, actually fine, thank you. Thank you.
So tell me, what happened?
Well, it was, I was walking on Seven Sister, and there was just a taxi driver who didn't see me crossing the road.
Really?
Yeah, and I don't know the name of this bone, but I broke it, and
any other injuries, or just
well, there are. It's just amazing that from that a lot of other things happened to me. I mean, this is the only thing that was injured,
Right.
but now I feel a lot of other things, and I want actually the student to think what other problem I can have from what you've seen that I can develop. Okay? So I fracture only the leg, but there any other compensation that you think that I might develop in terms of aches and pain that might be part of it. Okay? In groups. Ooh. Ah. Okay. Right.
So when did this happen, Joel?
Yeah, 2 weeks ago.
Okay, and they put the cast on immediately.
Yeah.
Or-
Yeah.
And what have they said? They're going to leave the cast on for 6 weeks?
They're saying about 3 months, and I can put a little bit of weight in there, but still not
lucky.
much.
Do
Yeah.
some. So, and are they going to change it to like a different type of cast,
I
or
don't
are you
know.
going to have this sort of very solid one for,
I don't know.
for
I've
quite some time?
had such a problem. You know, I'm self-employed, so now I have to find other people to replace. It's just not in a good time.
Yeah,
not a good
absolutely.
time. I guess there is never a good time, but
No, definitely not.
yeah,
And is it really? Are you on any medication for it? Did they give you anything at the
nothing.
hospital? So you're not taking any painkillers?
No.
And what about? Can I go as fast as this? What about
Yeah.
sleep? Are you
I'm fine.
sleeping
Yeah,
okay
yeah.
at night?
Yeah.
You're managing to prop yourself up?
Sure.
and-
Sure, yeah. Okay, what other questions you want to ask me? In group. What do you want to assess? What do you want to dig in? You see what Alison said is just trying to feel what's going on about me. Because later on she's going to do the treatment accordingly, okay? So we'll give you a few minutes, okay? Go for it. Good? Okay. Yeah.
Yeah, you
Oh.
okay, so you said you're sleeping okay, and when you
Mhm.
sleep at night, what position are you sleeping in?
I sleep more on the right side, but I can sleep on the back actually also.
Can you? So
Yeah.
you're okay on that side
Yeah.
and on your back, and
Yeah.
obviously on your tummy is a little bit
I,
uncomfortable
no, I don't think it would be comfortable.
with the cast and
No.
things. Okay.
No.
And since the accident, have you noticed any other sort of pain or areas of tension in the
Yeah,
body?
absolutely. I mean, that's more, I don't know what you can do about that, but I put so much weight on the right side that I feel it's very stiff, and both the forearms here,
Yeah.
I feel like
Very
it's
tight.
really burning. It's really burning because I type
Right.
and then
On the crutches.
Crutches,
and
yeah.
things like that. Okay, so you're really feeling it there.
Mhm.
What about sort of in the
Shoulders
upper
fine,
back at all,
actually,
and
no,
the
it's
shoulders
fine.
and neck and
kind of
things?
fine, yeah.
And you didn't hit your head
No.
during the collision, and the hospital cleared you with concussion
That's fine.
and things like that. Okay. Do you want to stop there? Do you want-
No, let's continue now
Okay.
then.
Right, so today then, from what you're saying, would be a really good idea to try and help with that tension in your
Oh,
legs
yes.
and in your arms, and,
Yeah.
and maybe even sort of around the elbow area,
Yeah, yeah,
where
yeah.
everything's attaching, is getting
Yeah.
a little bit tight,
Mm.
and perhaps help with a little bit of relaxation work
Sure. Okay.
and things like that.
Right. How about stop now? And what I would like you to do is to base your treatment for that client. Okay? Base the treatment on that client. And I would like to know which technique you're going to do, which technique you're not going to do, and where. Okay? Shall we start then? Good.
Groups.
Sorry? Groups, yeah, in groups. Okay. Hello, Alison.
Hey, Joel, how are you?
Good,
You look
fantastic.
much better.
Yep, yeah, I'm.
How is everything?
It's good, yeah. I've, cast is off. I still have a bit of limping, and yeah. What would you like to ask me? Shoot questions.
Is it still pain in the leg?
Yeah, still in pain.
How's it affecting you?
How does it affect me?
If you feel pain when you started,
When you
when you touch.
yeah, when you touch, good.
Been working again.
Am I been working again? Good.
How was the last massage? Did it actually help you?
Fantastic. All these are good questions because what you're trying to do is assess and see, doesn't matter the fracture, what's the person? Remember we said about each problem, you have the name of the problem, but you need to know how it affects the person. So you're actually putting more time in knowing how it affects the person rather than what is written in the encyclopedia about this problem or that problem, because it doesn't mean anything almost. Yeah? Good. And if, say, now I'm a lot better, I'm walking, I have a bit of a limp, I feel that actually I touch it and it's tender, but I can still do that. What do you think would be your massage? Can you touch that area?
Yeah.
Yeah? Okay, good. Because I start putting weight on that, it's better. And are you going to do hacking or maybe not? Good. Yeah. So you're starting slowly to try out and see, maybe you can do some light effleurage, maybe a light petrissage, but not too deep. Yeah.
It might help with the recovery process.
Absolutely. You increase blood circulation. Absolutely. Good.
Getting rid of the dead stuff.
That's actually the basis of what we want you to develop during the course. Kind of, a little bit of theory, but a lot of communication, assessing the client, and then thinking what massage can help and when not. Yeah?
It's so important, isn't it?
It's very important.
It is included in a lot of the homeworks, and it's a real thing of mine. I always bring this up, don't I? Especially the last few, is that it's so important for you to do that part of the homework and looking at when it's an acute problem or a chronic problem and the difference in how you treat it, because all those homeworks dealing with that become your own kind of little reference book or Bible that you then know, okay, so that's how I would adapt my treatment, because in reality that's what happens.
Yeah.
People come to you with these things, and are you going to treat them, and if you are, how are you going to treat them? So it is really, really important. I find it quite fascinating how we change our treatments or things that we include to really help that person. But it's really, really important. So whenever that's in a homework, really take the time to think about your massage recommendations for that pathology, as well as understanding the pathology, but how massage changes, because that's what will prepare you when you're treating people afterwards.
Yeah. Cool. Stopping here, and we